Welcome to another episode of Dr. Rob, Pain Detective. I'm your host, Dr. Robert Pumahawk, where I take a look at the causes behind your pain and then provide you with a solution that's proof-driven. On today's episode, we have Brandon Brocato, a comedian and a Los Angeles native with 17 years in the entertainment business. He's a SAG actor since 2002, with roles on House MD, Smiths, Days of Our Lives, and many, many more. Trained in improv, acting, screenwriting, and producing. Brandon naturally made the transition to comedy in 2015. Currently in the process of creating and producing multiple projects. And welcome back. Brandon, thank you for being here.
Thank you, Dr.
I appreciate you taking the time to come on my show and talk about your health problems you've had for quite a while now. So
absolutely.
Thank you for sharing.
I appreciate the scans and all the free medical stuff.
I got to see a little bit about your shows that you're producing right now.
Yes.
Hilarious stuff. Wonderful.
Thank you. Got the cartoon show, Gone Gnomes, and another project that's a little top secret right now, so I can't share with people. But you got to see it. You are privy because you are helping me out, and I like running things by you. I like you, Dr. Rob.
So as a comedian, you might be taking your health so maybe not so seriously. But we talked a little bit, and you've been having some major health issues for a little while.
Yeah.
Do you want to tell our audience about those things?
Sure. I'm a smoker and a drinker, and I've always kind of taken my inspiration from comedians that died a little early. So I don't know. I've always kind of told people that the reason I got into comedy was so that my tragic death meant something. But now that I'm starting to get a little bit of success, I'm backpedaling on that now, and here we are today.
Cool.
Yeah.
So what's been going on with you? Let's talk about it.
I've been having back issues, man. Upper back. I don't get a lot of lower back. I've had a shooting pain that's going down my arm, and every time I Google it, it says I'm either going to have a stroke or a heart attack like any minute. So I've been pretty worried about it. But I'm not really a doctor guy, but my friend referred me to you, and I may be skeptical, but let's see if you truly are the pain detective. Let's see how this goes down.
So let's talk about your past growing up. Athlete, not an athlete, played extreme sports. Like, what did you do that may be contributing to the problems you're having now? Because a lot of things, when people are having problems now, it's from when you're youth, right? Yeah. So let's talk about those things.
Wasn't a huge athlete. I wrestled in high school.
That's pretty competitive.
It was pretty competitive.
Injury-prone sport, right?
Yeah, I never really injured myself too hard. I actually did jam this shoulder one time, but
that's where you're having the pain in the hand?
Well, yeah, it's shooting down here,
Gotcha.
but that was years ago. But really, the neck and the upper back are from these two car accidents that I was in. And one of them, I was in a reclined position with the seatbelt on. So I literally came up and just got like a gnarly whiplash and then thrown back.
Wow.
And I actually saw, when I was younger, the insurance paid for chiropractic and stuff, and it kind of dealt with that. But over the years, I felt it get worse and worse and worse, particularly in my neck. And I just kind of self-medicated to deal with it. Smoked a lot of ganja, just drank the pain away, So I'm at the age of 38, I'm kind of getting to the point where maybe I should be talking to a doctor about this rather than just
probably a good idea
doing it myself on the internet.
Let's go back to the car accidents. You had one how long ago? Do you remember when it was?
Man,
was it when you were a kid, just recently?
I must have been 9 or 10.
So like 30 years ago?
Yeah, pretty much.
And then wrestling, how long did you perform that or participate in wrestling?
Wrestling, I was in for 2.5 years.
And then you said 2 accidents as well. So the second car accident was more recent or also as a kid?
Yeah, no. They were both when I was a kid. One was, I was a 15. The one where I was reclined was I was younger. But then, you add in years of surfing and trying to skateboard. I was never good at skateboarding, so I usually just fell on my ass. So, I mean, there's been lots of things that have been attributing up to this. I kind of always just shake it off, So
let's just say that you've had traumas in the past that might be contributing, but nothing recently.
Nothing too crazy recently.
And how long has this stuff been going on for? A year, 2 years, 6 months? Like, what's the situation?
The shooting pain's been going on for about a year now.
Wow.
And the only way I can alleviate it is by stretching my arm out like so.
That helps.
And it helps with it. But I was under the impression that maybe it was like a pinched nerve. I didn't think it was like an actual shooting pain from like a heart attack or a stroke, even though the internet constantly tells me that that's what's the reason. But I personally, that's why like when I got the opportunity to come here, I was excited about it because I knew that you would probably break it down and figure it out for me. Nice. Yeah.
So a couple stats. Kids fall, right?
Yeah.
I have two boys. I've seen what they go through. By the time you're 10 years old, you've fallen 10,000 times. So lots of traumas. I mean, you're learning how to walk. You're playing sports. You probably got hit in the head wrestling. You just remember those things. Another stat, car accident, right? 80% of people that get into car accidents, 8 years later, they're still suffering from pain.
Yep.
And the main reason is because of spinal issues, neck pain, because of trauma, whiplash, and the disorders that come with it. And the main cause is ligament damage.
Yeah.
Just like if you have a knee problem, you tear your ACL, problem with the knee. Well, in whiplash cases, 2 car accidents, maybe some head trauma from wrestling, the ligaments in your spine and your neck may not be stable, contributing to why you're having the pain.
Yeah.
So we got to examine different causes behind what's actually happening and then tell you how to fix them. So the less guessing that we have, the more it has to make sense to you, the better off we all are. Because why would you want to take care of it if you really don't know why? Any other reasons why you may be having these problems? Do you sleep on that side? Do you have a hard time sleeping? I mean...
Well, it depends. If I'm blacked out drunk, no, I have no problem sleeping. But you could say that. In later in my age, I used to have very restless nights where I would stay up. And now that I think about it, I kind of do prop my head up to watch TV like while I sleep. So that can add to it occasionally. So now that I'm thinking about it, I guess so. That could be adding to it as well. But lately, if I'm going to sleep, I turn everything off and then I'll just lay there and I'll be out usually by 15 minutes.
So you are making conscious decisions and efforts to kind of help manage the problems, but it's still happening.
Yeah, well, I'm on the wrong side of 30 these days. So
you're still young.
Yeah.
You're not the wrong side of 80.
Yeah, that's
true. Maybe that's what your body is
internally.
Not
for 100 years ago, I'd be an old man ready to go by now.
So that makes sense. I mean, so my approach is very simple. Take a look at you as a person, find out what's going on with you, and then solve those problems. At least that way, you're not guessing anymore. It doesn't frustrate you anymore. You realize the things you can and cannot do to help your problem. And so that's what our approach is.
Okay.
You ready?
Yeah, I'm ready. Let's do this.
And we're back. So Brandon, welcome to your report of findings.
I'm here.
We stepped away, did all your diagnostic testings. Right? Did a whole bunch of examinations, which you kind of maybe understood, maybe didn't understand. But that's the information that we use, third-party testing, to figure out what's happening with your body. So welcome to the report of findings.
Sweet.
The purpose of today's visit is to understand the cause of your pain, provide evidence-based solutions, and to come up with an individualized treatment plan. We have a comprehensive approach here where we're an integrated medical office. Not a lot of people do this. We combine physical medicine with cellular medicine and regenerative medicine. So I oversee the physical medicine department, and then we have specialists in the 2 other fields that help me figure out how to fix your problems.
Oh yeah, this place isn't just like a hospital office. This is like a Russian, genetics department. They've got everything here. It's ridiculous.
Yeah, like the Star Trek room, right?
Yeah, absolutely.
Pretty cool, right?
Absolutely.
Just come to see that.
No, absolutely. Check them out. They're awesome here.
So the 4 pillars of pain of why you're having discomforts or chronic conditions like your neck and your shoulder situation are from muscle degeneration, neurological degeneration, spine degeneration, and then soft tissue degeneration. What I mean by soft tissue is discs, ligaments, cartilages, things of that nature, things inside your body that also have to be addressed.
Yeah, the buffers that are in between the bones.
Yeah, so the first thing we'll be discussing is muscle degeneration.
Okay.
So how I do that in my office is by examining and evaluating how you stand.
Yeah.
Because most people don't even know how to stand properly.
Yeah.
We think we do. We think maybe I have good posture, maybe I don't have good posture. You mentioned that your posture is kind of okay and you work on it.
Lately, but it's never really been a concern to me. In fact, I've pretty much had bad posture my entire life. Okay. I think I've always been a little bit more interested in looking cool than standing up straight. Yeah.
And with science technology these days, the cell phone, the computers, the text neck, those are all factors that definitely contribute to your health problem that you're experiencing.
You called me out earlier when I was on my phone and you were like, hey, how about bringing the phone up to your face?
One thing that we examine is your posture. So we're gonna take a look at your posture right now. So Brandon, there you are. Look at the picture on the left-hand side. You see that character drawing?
Yeah.
That's a normal posture. There's a line that divides the front of the body and the back of the body, from the ankle to the knee, to the hip, to the shoulder, and then to the ear. Yeah. The muscles in front bring you forward, the muscles behind bring you back.
Oh yeah, look at that, I'm off.
You're the red line.
Yeah.
Close, but not so close. Here's what's going on with your body. From the ankle to the knee, you're shifted slightly forward, right? 0.53 inches forward.
Yeah.
From the knees to the hips, you're going slightly forward again, only 0.45 inches forward. And then from the shoulders are shifted backwards. So you're going forward to backwards by over an inch.
Yeah.
And then from your shoulders to your ears, you're shifted another 1.62 inches forward.
Oh, wow.
So you're kind of all over the place. Your head weighs approximately 17.4 pounds based upon your height and your weight.
That's not what it says there.
It does. Exactly, it doesn't. Because of the shift forward of 1.62 inches and based on calculations, your head now feels like it weighs 45 pounds, not 17 pounds. Yeah.
I feel that.
So when people tell you you have a big head,
Yeah.
you do.
Wow.
So imagine what your neck and your shoulders are constantly doing, because if you're that much forward, your body says, I don't want to bend over and fall forward. I have to use all the compensating muscles to pull back.
Which makes them uneven and makes them not healthy. So it adds to strain, adds to pulling on everything.
Yeah.
All in the area that I'm having problems with.
You can fix this, and I can show you how to fix it. One of the things we talked about earlier was don't bring your head to your hand, bring your hand to your head.
Here. You
Right?
truly are the pain detective,
We're
aren't
getting
you?
there, right? So when you drive home tonight, take a look to and you're stuck in traffic, look to your right, look to your left. What are those people doing?
Same thing.
They're putting themselves in a state of stress. And then we wonder why we have road rage.
Yep.
Because you're causing it so you can fix it. Now, the hand position. See how they're in your front pockets? Mm-hmm. They're not supposed to be there.
It's supposed to be back.
They're supposed to be in your side pocket.
Okay.
When you have your hands forward, it rolls your shoulders forward.
Okay.
And then you have a physical therapist or a doctor saying, roll your shoulders back.
Yeah.
So my recommendation is to put your middle finger down the side of your pants, not the front of your pants.
Okay.
So by bringing your hands back, you bring your shoulders back.
Okay.
So now by eliminating your head forward position and your hands forward position, you're now taking the pressure off the back muscles and having less stress and tension and pressure.
Okay.
So when you have your hands forward and your head forward, what's actually happening is this. Your muscles are never in a state of rest. So you're doing nothing. You're just standing and you're already making those muscles work too much.
Yeah.
Imagine going to the gym, lifting weights, performing, reading, writing, producing.
Yeah.
You're actually having your muscles do something, but they're already under stress to begin with.
Yeah.
And then you're adding more stress. Hello, eventually your body has to warn you.
Yeah.
And it's saying, I'm in pain.
And it is.
So imagine that. Same thing with your lower back, right? It doesn't matter if you're having a shoulder or neck problem. Understanding how to balance off your core, super important. Good posture, no problems. Bad posture, problems.
Yeah.
And then we talked about having problems on the right-hand side, correct?
Yeah.
So take a look at this picture here. Which way are you leaning?
Yeah. To the right.
You're leaning to the right.
Yeah.
So is that a factor that's contributing? Do mirror imaging exercises or watch your posture, figure out why you're leaning on your right foot, turning your right foot out, driving your car instead of having your foot straight ahead.
Yeah,
Maybe
my
leaning towards
my
that side.
left foot is usually up on the dash like this.
That's even worse for you. So just by changing your posture, which we show you here, spending more time in a better posture. Listen, we're not going to always have great posture, but I'll teach you how to find your neutral position so you can take away that factor that's contributing to your pain and eliminate it.
It sounds awesome. I'm in.
And so what we do here is we provide you with something called mirror imaging exercises, okay? You're not going to the gym yet. You're not lifting weights yet. What we're doing is helping you understand how to find your body neutral.
Yeah.
So that when you go do your exercises, you go do the things you enjoy doing, find out how to find your posture, improve those things so that when you go to the gym, you're in a more neutral state.
Yeah.
And the risk of injury gets reduced. What I do with my patients is I allow them to be inspired because they're now educated, they understand what's happening, they play a role. So solution for the problems you're having muscular imbalances are these. Muscle degeneration therapy or treatment in my office. We use a Theragun as a percussive form of relaxing the muscles, kind of like massage. And then your homework is a home therapy stabilization belt. Because you're rolling your shoulders forward, I give this simple thing that you can buy on Amazon that helps you roll your shoulders back so when you're not focusing on your posture and you're getting the soreness, I have a tool, I have an aid. Because we all need some help.
Yeah.
So problem number 2, okay? Neurological degeneration. So what we did is we evaluated you with a nervous system scanner. We did 3 different tests, an overall score. Then we did a motor component to see how the spinal muscles neurologically are working either too much or not enough while you're sitting.
Okay.
We shot at sitting because when you're standing, you're carrying bowling balls around.
Yeah.
And we want to see what you're doing when you're sitting.
Yeah.
Because those are 2 things that I can help modify or change because when you're sleeping, just get good sleep.
Yeah.
Right?
Yeah.
And then we also scanned your sensory components to see how your autonomic nervous system, things inside your body, might be in a state of inflammation.
Okay.
That might have those symptoms or maybe contributing to what's happening inside your body.
All right.
Like when you talked about the pain going down your arm or you have a heart attack.
Yeah.
The heart manifests a symptom as wow, pain down my arm. It's not your arm, it's your friggin' arm.
Yeah.
So what we have here is called the core score. It's a combination of all the 3 different tests that we ran.
All right.
Okay? FDA approved. We use it as not a diagnosing tool, but just as another piece of the puzzle to help you understand what can be done and if it's contributing or not.
Yeah.
Right? So 61 out of 100.
That's a fail.
This is testing your body's ability to handle stress. The top number is 69. We won't laugh, but it's kind of funny. Right? That's looking at something called your heart rate variability.
Okay.
What it is, it's your body's ability to handle stress by measuring your heart cadence.
Okay.
So it's testing in your autonomic nervous system, looking at your sympathetic, like you're being fight or flight, versus your parasympathetic state, being in a relaxed state.
Okay.
Your number is 69. That means you're in the sympathetic state. It feels like you're being chased by a bear. So we have to figure out how to fix that.
Okay.
Mindfulness, breathing, meditation, yoga, drinking water, which you do a lot of.
I do a lot of water drinking, yeah.
But your nervous system also plays a role. So if you
Okay.
stimulate the nervous system, we'll improve that as well.
All right.
Got it?
Yep.
39. That's the lowest number of the bunch.
Yeah.
That's the nerves that are controlling your postural muscles. So your body's been breaking down for quite a while.
Right there
And now
where it
your
hurts.
body's warning you.
Yeah.
That's where it hurts. And now we'll be examining your nervous system, the second potential problem that's contributing to your pain.
Yeah.
The reason we're evaluating the nervous system, right,
Yeah.
is because it controls everything. Every cell, every organ, every tissue, every muscle. You have 3 scans here. The one on the left indicates where the pressure is being placed.
All
I'll
right.
go over the colors in a second, okay? The one in the middle shows you asymmetry, left versus right, where you're having more pull or not more pull.
Yeah.
And then the picture on the right indicates your overall energy index, how much energy you're using to sit. Your number is 274. Normal
guessing that's high.
is 100. So you're using 2.74 more energy than you should just for when you're sitting.
Might explain the fatigue.
Minor stress would be green. Moderate stress would be blue. Red is severe inflammation of the nervous system that's controlling your posture. And black is more than that.
I got some white up there, but there is definitely some red and some black that is not good.
How do we fix this? Well, directly what we do to improve the system is we work on the nervous system. And how do we do that? By the chiropractic adjustment. That's the one amazing thing about my profession is stimulation of the nervous system. What I now do know is that the chiropractic adjustment will help with the nervous system inflammation. So what do we do for the nervous degeneration treatment component? We talked about the chiropractic adjustment, or if you don't like that, we also have acupuncture here,
Okay.
another option. Then we have home therapy, get a TENS unit on Amazon, or we can get it for you, inexpensive. Relax the muscles of the postural muscles so that way they're relaxed and stimulated. You can do that at home, right? And then we also have your cellular medicine evaluation with our wonderful doctor, Dr. Mike.
Okay.
The next piece of the puzzle is going to be your structural system. And the reason that's important is because, well, we have to examine how the spine plays a role. So I'm going to pull up your name right here.
Ooh.
The image on the left is a neutral picture, a healthy spine.
Yeah.
It's showing us where the curve is supposed to be, that green line.
Yeah.
Normal, 42 degrees.
Yeah.
Okay? Each of your bones is supposed to be the same size. The spaces in between your bones, those gray areas, are your discs. Okay?
Yeah.
And then also we're looking at the slits behind that green line that are kind of on a horizontal angle. That's where the nerve is coming through. You're the picture on the right.
Yeah, that's what I was looking at, was the one with the red going in the
Yeah, that's
complete
right.
opposite direction.
Not so close, right?
No, that is.
So it's called spinal misalignment. There's only 1,800 doctors in America that specialize in that, and I'm one of them.
Okay.
So this is something we have to examine because how it contributes, and then we have to fix it.
All right.
You have 114.5% loss of curve of your spine. So that spine is not about, how old are you?
I'm 38.
Yeah, it's not a spine of a 38-year-old. And what we saw in your x-rays is that you have a loss of curve.
Yeah.
So then what happens there is those bones approximate in the front. They put pressure on that disc.
Yep.
That disc goes back. It puts pressure on that nerve.
Yeah.
So the solution for that is something called decompression therapy. For your loss of curve, Brandon, we have to pick a specific spinal correction therapy that has to be matched to what you have a loss of curve. In this image right here, this girl's sitting down. You have a reversal of curve, so I have to have a pulley that's pulling you forward to help with that reversal of curve.
Yep.
And then your upper part of your neck at C2 is too far forward. So
Yeah.
you have to slightly pull it back. And so why do we do that? Is because when you're having a loss of curve of your structural system of your neck, it affects different areas. It's trying to figure out dive into your health, figure out what factors are contributing so your overall health is also improving.
Okay.
Not just your shoulder pain, your numbness, but how do you be healthy?
Yeah.
That's what we got to help with.
Okay.
Now you talked about how the pain goes down into your arm and shoulder, right? Well, look what C5 controls.
Exactly where I'm having my issues.
So when we looked at C5 in your x-rays, it was not even close to where it was supposed to be.
Yeah.
Now, look at C6 and C7. They control pain going down the arm, into the shoulders, in the spots that you're having the problems, right?
Yeah.
But also look at that right image there. The muscles are the organs inside your body.
The heart and lung.
Your heart and your lungs. Listen, stats show that 50% of us will get a heart attack. Either you or me will get a heart attack. 25% of us, right?
Yeah.
Will die from a heart attack, and our first symptom is we're dead. So there's a good chance that you or me will die from a heart attack. But what if we can eliminate one of the causes behind having heart dysfunction, heart degeneration, heart disease?
Can alleviate that risk.
Taking the pressure off the nervous system that controls your heart.
Yeah.
Other factors are definitely contributing. I'm not an expert in cardiology. What I am is understanding how the nervous system contributes or controls things outside your body and inside.
Copy.
So while we're helping you with your neck and your shoulder, let's help your heart.
Okay.
What happens if you don't fix this? Do you think the problems will get better, or you think the problems will get
No,
worse?
the problems are going to get worse.
Yeah.
It's just going to add to it, and then it's going to degenerate everything. So from the ligament, the tissue in between the bones themselves will start to deteriorate, and in cases they can fuse too.
Exactly. So here's a decay situation that shows the progression or breakdown if we don't fix it. So you're right about here, right? Loss of curve. And the next 5 or 10, 15 years, those spaces in between your bones get smaller and smaller. These little things right here in the front of your bones are called osteophytes or arthritis. Then the disc sizes in between here, between your bones, the gray areas, start to disappear and go away. Look at the reversal getting worse and worse and worse until your neck looks like junk. So you're not there yet.
I don't want to look
if you
like
let
that,
it
Doc.
get there, it will get there. And eventually what happens, I can't fix that. What do we do for spinal degeneration treatments? We do the decompression therapy for the disc pressure. We do the spine correction therapy, which we're putting into that tractioning unit that's pulling it forward and pulling it back because it's reversing the situation that you have with your neck. And then also for home therapy, because you have to contribute and participate.
Okay.
Fixing the neck takes a long time. Like think about braces.
Yeah.
2 years.
Yeah.
Over 700 days to fix your teeth.
Yeah.
And then 2 more years of a retainer. So what we do here is we treat you for 16 visits, but you participate by doing this 30 times at home.
Okay.
So now 30 plus 16, we've done this 46 times.
Yeah.
Right? We're gonna have progression.
Okay.
How much are we gonna have? I don't know. That's why we reshoot the x-rays and do a pre and post comparative study.
Okay.
After 8 weeks.
I'm stoked.
Pretty cool, right?
Yeah, let's get started on this.
Now, the last piece of the puzzle that we have to look at is what's actually happening with your stress view x-rays by looking at your neck when you're moving forward and when you're moving back. So when we have those pictures, we take a look at right here and right here. So the picture on your left-hand side is you bending your neck forwards.
Yeah.
The picture on the right-hand side is you bringing your head back.
Yeah.
Flexion versus extension. You see those red lines?
Yeah.
Yeah, they're not supposed to be there.
Yeah, I see that.
So at the red lines of your neck bending forward, that's C2, C5, red lines, right? Looking going backwards, C2, C3, C5, and C7, all not in a good position.
Yep.
That indicates to us that you're suffering with ligament instability.
Okay.
Now this has to occur with some form of trauma. In your situation, you talked about a few different traumas.
Yeah.
Well, guess what? When you're having that, you're 40 times more likely to suffer with chronic pain because the ligaments aren't holding things in place. So just by looking at this image, we now know that the ligaments that are being affected are from some form of whiplash injury.
Yep.
Now we also have something called a digital motion x-ray to further evaluate this. So now we take a look at this ligament here when you're bringing your head back is no longer stable.
Oh, dude, look at that.
Which then that disc, that blue area, rubs, putting more pressure on the disc. And this opening right here where the nerve comes through, guess what? That's also being squished or compromised.
Yeah.
It's like kinking the hose, and you wonder why the water doesn't get through. Same problem. This is a problem. I can't fix this.
Yeah.
Hence, the regenerative medicine department can. When you're bringing your head forward, you're also having ligament damage on the posterior longitudinal ligament,
And I mean,
PLL.
that entire nerve right there is almost disconnecting and breaking.
It's not working. And then because you have that massive loss of curve, these ligaments are also problematic. The capsular ligaments, they're part of your facets. The facets are the primary drivers of pain in the neck. Why? Because when they're opening up that much, look what they're doing to that disc.
They're ripping.
They're squishing it. So unless you fix these ligaments, that disc constantly gonna have pressure on it, and hence you're gonna have a disc herniation, and then what they do is they cut your disc out. Then you're also having problems here. So 4 ligaments are potentially damaged in your spine, contributing to why you're having neck and shoulder pain. So we're one of the only offices in all of LA that has something called a digital motion x-ray. Now take a look at how cool this is. We actually shoot your spine in motion.
Oh, wow, look at that.
Because when you're moving, you may be in pain. It's like, doc, when I move my head this way, it hurts more than this way. Well, hence, look at your spine in motion to determine why you're having your pain when your head's in that position.
And you can see the irregularities that where it's not clamping together and coming apart like the way it's supposed to be.
Pretty amazing stuff, right?
Pretty cool, yeah.
Then we even go even further than that. So then from your x-rays, we then do a biomechanical assessment to determine which ligaments are actually problematic versus potentially. So it gives us more proof behind it. So now we bring it even further. We actually have a statistical analysis of everything that we shoot in the x-rays by giving you a impressions report or a biomechanical assessment of your x-rays. Nobody does this. So we take a measurement there, indicating how far those spinous processes, the things you feel in the back of your neck, how much separation they are. Those numbers are all supposed to be equal, and they're not,
those are off.
Right? So another measurement tool to take a look at information. And then we have different types of measuring systems. Why? Because you want to cover all the bases. So at C2, C3, you see that number that's in red?
Yeah.
Ligament damage.
Yeah.
Right now we're proving to you that we're actually having stuff. I can't make this up.
Yeah.
It's a statistical analysis by researchers that's putting this stuff together that's telling me, hey, Brandon, you got some problems going on.
Yeah.
And guess what? They're contributing to your problems.
Yeah. We get it. My neck's screwed up. Can we get on to what we need to do next?
Well, yeah, your nervous system is being compromised because the ligaments in your neck are just not working. Consequently, you may be rateable for a permanent injury upon reaching maximum medical improvement. So if I don't fix that, I ain't fixing you. So to break it down for you, our treatments are 8 weeks long.
Okay.
You're coming in twice a week.
All right.
And then you're seeing different providers as we go through.
Okay.
Regenerative medicine, cellular medicine, doing a combination of different therapies every time you're coming in. Conversations, how are things going, what are you eating? Look at an overall perspective. Every visit lasts about 45 minutes. You're in, you're out. Then we're training you again to get better health.
Yeah.
And the way we do that is because of why. When it comes to your overall health, how your body functions, what's actually happening inside your body is a road to recovery.
Yeah.
So you make the decision. Do you want to do nothing?
Yeah.
That's an option.
No. I want to play ball here.
Or you want to just work on symptom care, right? Just focusing on the crisis, pain, super important. But once again, if we're only focusing on that, we never get you out of pain.
And it's going to come back.
Exactly. Do it now, do it later, harder to fix, potential surgery, or do a combination of symptom care plus correction care. Knowing the pain, finding the causes, then reevaluating them at the back end, right?
Yeah.
How do you stabilize all the things that you might be contributing to your problem? Hey, doc, I'm doing this exercise this way. Should I change it? How about this for breakfast? How much water should I be drinking? All those things are super important. We talk about those things.
Yeah.
I've been doing this for 30 years.
Yeah.
I've been an athlete. I've had my injuries. So if I can help myself take care of myself by the things that I'm doing, I share those things with you. And in an optimal world, we get you right over here, getting you back to better health. Then we reevaluate you.
Yeah.
In an ideal world, you want to be up at wellness care.
Yeah.
Never having to worry about chronic conditions for the rest of your life. Your health is attainable. You just need to go in the right direction.
Yeah. Well, I've definitely been going in the wrong direction for a while, so maybe you can open my eyes to this, doc.
I think we just did, so.
There's no doubt about it. You are obviously the pain detective. That was absolutely awesome, Dr. Rob. Thank you so much.
Appreciate you being here.
It's my pleasure.
Thank you, everyone, for joining us on another episode of Dr. Rob, Pain Detective. So to summarize what we heard today, we realized that Brandon's having a neck situation, pain going down his left shoulder, where he's having numbness. It's been chronic for quite a while. He did have some injuries in the past from playing competitive sports, 2 major car accidents, surfing, and roller skating. So we figured out the causes behind his problems, the 4 pillars of pain: muscle degeneration, neurological degeneration, spinal degeneration, and soft tissue degeneration. Then we came up with a plan to fix those 4 different pillars of pain. For the muscle degeneration, we'll be doing gun work, theragun work, percussive work to relax the muscles. Then for his posture, we'll show him a couple of different things he can focus on a daily basis, plus provide him with mirror imaging exercises. Then the nervous system degeneration, we'll handle that by either chiropractic adjustments or acupuncture. The spine degeneration, composed of a couple different pieces. When the bones were out of alignment, they put pressure on the disc, that put pressure on the nerve, and the whole system's breaking down. So we had to do decompression therapy to handle the disc pressure. Then we had to do the spinal alignment correction therapy to handle the bones out of alignment. And then for home therapy for that, we also provide the patient, Brandon, with a piece of equipment so he can participate in his own health. Then we take a look at the soft tissue degeneration. That's not my area of expertise, so we bring experts into the mix. We bring an expert radiologist, pathologist that takes a look at specific MRI and does specific markings to understand ligament damage and disc degeneration and inflammation. And then we have our researcher in regenerative medicine, Adam, for 15 years, look at the x-rays, the MRIs, and then come up with a plan to fix those ligament damages. So overall, we're fixing the 4 pillars of pain. Every visit you're coming in, we're doing 16 sessions at approximately 40 minutes. And then on your 16th visit, I reshoot all your data. Then we do a pre and post comparative study to figure out how much improvement we've had. And in Brandon's situation, we'll definitely make wonderful changes because I know him. He's caring about his health even more and more and more. Now he knows why. He's going to participate, so we're expecting great results. Thank you for watching another episode of Dr. Rob, Pain Detective. We'll see you next week.